6 months ago, it was hard to get a vaccine in Talbot County. For people who wanted one, demand greatly exceeded supply for weeks and weeks here in Talbot County. The health department was doing a yeoman's job to have regular clinics each week where they could serve hundreds of people. Those clinics, because of the size, were being held out at the community center. And community members who wanted a shot had to go online, make an appointment. It often seemed like those appointments went very quickly. So there was a lot of confusion for some of our community members who were interested in getting a shot about how they get one. I think some people, quite frankly, felt discouraged and lost in the process. I, from the county role, joined forces with the health department to set up this vaccine equity work group here in Talbot County.
One of the reasons why the Vaccine Equity Task Force was started was to reach out to, lack of a better term, an underserved community. Folks that weren't getting vaccine for one reason or the other. So, and that included a lot of the more populations of the minority community.
The health department was expressing concern about this data, wanted to respond and make sure we increased access. So initially, our first effort with the Vaccine Equity Work Group was to bring together some concerned community members, people who are really trusted voices and allies in our community, some with health background, but law enforcement, faith leaders, nonprofit leaders, and just informal grassroots leaders who have a great web in the community and were people we knew that were trusted voices.
There was a lot of hesitancy. Actually, I think we counted over 90 people who actually told us they weren't comfortable with getting the vaccine. They're stigmatized by different things that usually have to do with systems. So if you have a system saying you have to get this shot, and you're the same systems that's been holding me back, then there's a trust issue.
There was a group of people I can remember going to a restaurant one time while we were giving the vaccines. And I think either Lucy from Choptank Health said, "Chief, we got 3 vaccines left." So I went around to the restaurants, knocked on the door, said, "We need you guys to get somebody in here, some from your staff that hasn't had the vaccine." And so a couple of the people that actually came after going out chasing them down, and I would ask them, I says, "Why you didn't have the vaccine?" "Chief, I just didn't make it a priority."
Like, some of the hesitancy that I saw was probably like being scared of the side effects or not really knowing like how it came about, like why so fast they got a vaccine.
Choptank did such a wonderful job because at the vaccine clinic they had doctors available, they had pediatrician available. We had one woman that was pregnant and she was very reluctant to get the vaccine. And so she was able to talk to I got her there, and then she was able to talk to a pediatrician who reassured her, and so she did it.
Choptank Community Health immediately came to us. We didn't have to ask them. They said, "How do we help?" As soon as they heard about what we were doing, because this is who they are and what they do, and they were equally concerned about access issues. So obviously with the health department, they were a vaccinator in this effort, but by also having Choptank Community Health available, that was a multiplier effect, so that we could make sure we had clinics available in the evening and on the weekends, again, because access and barriers to access were such a concern.
So we know what brings people out in our community: food and entertainment. And as long as they're free, you're good to go. So Keisha and I had an idea to actually create an opportunity to give people access in our community to the vaccine, and we called Lucy Hughes, and it was a go.
The Multicultural Festival is something that we've run for 20 years, and it has always been a great community building event, but it has often been focused on food. And we are really at a point where we were thinking that we had to postpone the event, despite the fact that it was being held outdoors at a time when we were really being told that being outdoors was safer. And I happened to be in a conference call where I was overhearing real conversation about vaccine hesitancy is in communities of color. And I thought to myself, God, it would be so crazy if the Multicultural Festival could be a vaccine event. And I texted Lucy Hughes from Choptank Community Health and I said, I have a really crazy idea. And I gave her a call, and the thing that I love about Choptank Community Health is she right out of the gate was like, yes.
When we had a clinic in St. Michael's at Union United Methodist Church, and Chief Smith down there in St. Michael's, I mean, literally he had his community volunteers going door to door to make sure people knew about this clinic, and we'd have planning meetings with Lucy and other team members at Choptank Community Health, and we had all these questions, and their answers were often, we've got that, we've got that, we've got that.
People started gravitating because they wanted to see what was going on. So as soon as we saw people that were walking into our blocked off space, we were literally engaging them. Have you had your vaccine? If no, then why not? What are your concerns? So even if they left not getting the vaccine, we wanted them to at least kind of rethink it. If there were any doubts, get educated on those doubts. And then if you don't get it that day, you know that Choptank Health is available right around the corner where you can just walk in and get the vaccine.
I kept a roster of people who had come in and asked for the vaccine but at the time weren't eligible, and then we give them a call back once it was. And I think that's how we successfully were able to get people to get the vaccine that day.
Participating in the Multicultural Resource Center and watching it be so incredibly effective at reaching the audience that we were trying to reach was probably a highlight of my year last year. It was just fantastic to see the hard work paying off and to see people who were so grateful and thankful to have the opportunity to get vaccinated, how important it was to them. It was a real high point in a year that felt really dark.
Because of the additional clinics that were set up, we know that well over 200 additional community members were vaccinated, thanks to those sort of grassroots, neighborhood-based clinic opportunities. And the best part of working with Choptank Community Health is they're yes people. So if we went to them and said, oh, we want to have a clinic on a Saturday and try to go till 6 o'clock on Saturday, could you help us? You know, the health department's already booked up. Yes was their initial answer, and then we worked back from there.
You get one shot in one arm, I mean, to me, that's a success. That's one more person that you've gotten the vaccine, one less person that may be susceptible to getting the virus. And it's comforting to know when you can reach out to a partner like that and they're there and they show up and no questions asked. And it gave me some comfort knowing that these are the kind of folks that we got out there in the community.